think. This will just be for a short time, hopefully about 20, 30 minutes. Okay, guys, let's get started. I'm going to start the recording to the cloud. This is for the SET students. Here we go. Okay, so this is OET medicine. We're going to focus on summarizing and listing in OET writing today. This is a really useful technique to save time, to be honest. Have you ever had the experience of seeing many case notes and you're thinking, how can I put this into my letter? The answer is summarizing and listing. Okay, we're going to talk about that today. First thing though, guys, can you all say hello? Can you just all put your microphones on and tell me, can you say hello?
Hello.
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 Hello, sir.
We have a nice class here. That was Aditi there.
Hello.
Aditi, can you say hello?
Hello, sir. Hello, sir.
Start off with a quick game, Aditi. We're going to do my tense game. Okay, so you've got to tell me what tense I type. All right.
Okay, sir.
I will have been there, or I will have been eaten when you arrive. What tense is it, Aditi?
Future,
This is
future perfect.
Just Aditi. Future.
Perfect.
Is she right, guys? Is it future perfect?
Yes.
Is that right? It is right. So this is the game. The game is you can all shout out as fast as you can. How fast are you with tenses? Okay. So I cut myself.
present.
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 Sample present.
Oh, we don't know, do we?
You passed my.
No, we don't know.
Maybe past.
It can be past simple
yes.
or
Present simple.
present simple. Why? Can it be
Because of the
Because
verb.
of the
Verb.
verb.
Not given.
It's
Cut.
a regular verb.
Cut is it's irregular. Yeah, it's the same in the present as the past.
And
Right?
also the time is
Not regular, it is irregular verb.
It's
That's
irregular.
what I mean. It's irregular. So regular would be with ed, right? Let's try this again then. This is a good game. So she was treated yesterday. What tense is that?
Past tense.
Past simple.
Passive.
Past simple.
This is again, I'm trying to trick you. Is passive a tense?
Passive.
Passive.
Passive a tense?
Passive.
Voice.
Passive is not a tense, right? So we can just say the answer is past.
Simple.
Past simple.
The passive is a voice. We say it's
Yes.
a voice, not a tense. And that's very important. If you get confused and you think it's a tense, you will.
Sir, I told past simple passive. I told.
Well, yeah, exactly. So, but obviously, I'm just asking for the tense. Okay, I'm just being very strict on this. But I know, Aditi, I can
okay.
understand. Remember, Aditi, I was saying I was very impressed with your essay that I saw the other essay because the grammar
Thank
had
you so
really improved. I would say that's Paul. Okay, so anyway, so everyone together, what tense is
Thank you so
this?
much, sir.
I have been experiencing pain.
Present perfect
Present
continuous.
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 Perfect continuous.
Yeah, present perfect continuous. Okay. This is just a game, guys. Present perfect continuous. We're not doing this today. Today, we're going to focus on something else. Okay. But I would really like you all to feel confident on the microphone. If I ask you a question, just put your microphone on and answer. I do have a nice little list of all names here. So feel free to comment on this class. Today, we're going to review yesterday. That's how we will start. Then we're going to talk about listing. I really love teaching listing because it's so powerful in OET writing. You can do a little bit of practice in the chat box. And then at the end of this class, I want to try and do some case note practice. Now, we might run over. Usually I run over, but we probably will finish today about 1:20, 1:30 finish time. Okay. So let's get started. Can I start with Sama or Dr. Saki? Can you say hello? Sama, are you
Hello.
there, Dr. Saki? What? Let's just review yesterday. What did we study yesterday?
I think summarizing.
Summarizing, fantastic. And Sama, are you there? Mireille, are you there? Mohammed? We studied summarizing. What is summarizing? Mireille, you never talk to me, Mireille. Again. She never says hi.
Summarizing is to
make it shorter.
Thank you. You two, you're saving me. Thank you. It just means summarizing is to make something shorter.
To make it concise.
Or
To make it
or
brief.
Concise. Dr. Saki, remember we said yesterday, this is not a verb. What is
No.
it?
No, this is not concise. Is not word. This is adjective.
It's an adjective. So don't say, guys, very often doctors and nurses, they say, Alan, I concised it. Right? That's wrong, right?
No.
If you want to use the verb for concise, it's probably summarize, right? So we talked yesterday about making things smaller, how to reduce case notes down. I gave you 3 useful examples of summarizing. Emily, could you put your microphone on, please?
Yes, Alan.
Do you remember that I said in OET, there's probably 3 very, very good ways to summarize. Do you remember what they were?
Yes, listing,
Listing, okay. What else?
comparison,
Comparison, okay. Yes, what else?
and main idea.
Main idea. Okay, let's talk about these then. Let's talk about, today obviously we are studying listing, so don't worry about this one. But what is comparison? Wasma, do you remember my example from yesterday about comparison for summarizing?
Yeah, like
Green.
yeah, same. Like if first it's say that like a patient first has one problem, and then the other day it's you know
Yeah, first it has the,
so we can say it's worsened.
yeah,
Like,
right. If there's many visits, you don't have to repeat, do you, guys? For symptoms, you can say Mr. Green's symptoms. Very simple. Have again. What's my
have worsened.
Okay. I'm summarizing because I'm not giving all of the details, right? Very simple. I'm not even teaching this one because it's so easy, right? I'm not even teaching that one. But is that clear for everyone? Anytime you can compare symptoms to something you already said, you're summarizing, okay? What about main idea though? Clara, yesterday we talked about main idea. Could you say hello? What is main idea summarizing? What is this?
Main idea is, for example, to aggregate or to group.
Aggregate, yeah. This is. I thought I was going to have to work harder to get that answer. Excellent. So how do I summarize with the main idea? Answer, Clara. Can you say again? To group.
To group. Yes, to group the.
To group together.
Together this.
Under
yes,
one.
for example, symptoms, treatments, medication, condition.
Yeah, I'll say one idea. Is that okay? Would you guys are you all happy with that? So I gave you a very simple example yesterday. Does anyone remember the simple example from yesterday of summarizing with the, here it is, I'll show you again.
Yeah.
Symptoms such as
Eye issues.
Right? So here we have blurred vision, watery eyes, itchy eyeballs, and bloodshot eyes. What is the main kind of idea?
Eye problems.
Symptoms.
We said eye problems, didn't we? Or you could say eye issues, right? And I could say, Mr. Green. So if I wanted to make Aditi, if I want to make a sentence, I can say on 19th May. Aditi, what can I say here? Mr. Green.
Mr.
Presented
Green presented with
Just Aditi, guys. Presented with
eye issues, if we want to.
Now let's stop here. Now, do you remember what I said? If I could ask this question to Yulia or Gabriella. This is main idea summarizing, right? Could you say hello, Gabriella?
Hello.
Is this always good? Should we always do this? This kind of thing, eye issues.
Yeah.
It's not, is it? It's not. Sometimes it could be very bad. Sometimes it can be very, very good. When do we know that this is good? Anyone? Emily or Safi? Hilal?
When the reader doesn't need it.
Yeah, well, it's not that they don't need it. They do need it because it's here. Otherwise, we would not put it in, right? But when the reader doesn't need what?
Details. Reason for
Need details, right? And that is the key. You know, sometimes people said, oh, I didn't finish my writing, or I didn't have enough time for the writing. It's because you're not summarizing. You're not seeing, you're probably giving too much detail, basically. All right, this is what we talked about yesterday. I'm going to give you another example. So simple. Okay, same idea. 20th of April, wheezing, coughing, tightness in chest, SOB. Hemat and Hilal, can you say hello?
Hi. Hello.
How do I summarize this one?
Respiratory.
Don't tell them the answer. How do I summarize this one? Mr. Green.
Mr. Green
Is it good?
had presented with
Symptoms such as
They're all giving you the answer. What are they saying?
Respiratory symptoms.
Respiratory.
problem.
I will say lower respiratory symptoms because
Yeah,
this is
well,
all related to lower.
There's many things we could say here, but
or
it's just
symptoms such as of, yes.
yeah, you could even say symptoms suggestive of. It's just another example. Okay, so we're taking all these individual words like wheezing, coughing, tightness of breath, right? Or tightness in chest, sorry, and SOB. It's all going into one idea. Okay, so this is what we spoke about yesterday. But do you remember I said, what is the problem with this? What do you guys need to learn? What is it that I need to learn? What did we learn at the end of last class? Things like this. Issues. Why is that word important? Why is issues important here, or respiratory as well?
Summarizing of condition.
For summarizing.
Well, what we need to have.
The main idea.
We
The
need
main
to have-
idea language.
Yeah, we need language, don't we? We need
Yes.
words. We cannot just say issues every time, right? So
And
I
sir,
gave you,
we can also
yeah. Go on, Aditi.
yes, sir, we can also use some diseases if it is given in relevant case notes. So we can write the symptom suggestive of this disease. We
Well,
can write that if we know.
Do you guys remember
This
the things that I showed you yesterday? Does anyone remember any of the categories that we looked at yesterday? Here they are.
Yes.
Right? We looked
Yeah.
at language, didn't we? We were looking at different
Yeah.
words like issues and problems, but there's many we can use. Does anyone remember what the issues, like summarizing language was? What did we say for the summarizing language for issues?
Symptoms.
Problems.
Final symptoms.
Okay.
Suggestive of.
It's easy. It's easy. This is why I said right at the start of the class yesterday, summarizing is easy. It's just don't do it too much, right? Okay, treatment summary. How can I summarize the treatment? His treatment was
Antibiotics, antiviral, antifungal.
appropriately, right? He was treated appropriately or accordingly, right? The same idea. Appropriate treatment was provided. What does that mean, Dr. Saki, if I say appropriate treatment was provided, or Almaz?
Yeah, it's mean that the required treatment was provided.
The required, what does that mean, the required?
The required, appropriate, with
Expected.
the
Well,
expected.
The
Yeah.
expected base.
You are all doctors and you would expect it, right? He had a headache, he was treated appropriately. What do you expect for a simple headache?
Or stop or rest.
Right? That's the idea, okay? And we can summarize. We don't have to say all of the treatment. You can maybe take 10 pieces of treatment and push it all into one small sentence if the reader doesn't need the details, okay? What about medication summary, everyone? Do you remember?
Antibiotics,
Summarizing.
Analgesic.
analgesics,
Something I forgot yesterday. Yesterday I forgot to ask you this. I forgot. But what about is there another way to summarize medication? Is there one more way? This is just we give the main idea, right? This is main idea. Is there one more way? There is.
Wait.
Yeah, go on.
Maybe appropriate medicine. Appropriate also.
You could say appropriate medicines were given, actually. Yeah, that's okay. There's two more ways. Okay, you could say appropriate medication was prescribed. Appropriate medication. But what about if we just give the names only? Is that summarizing? I think that's okay, right? So you could say something like, what could we say here, guys? He was prescribed 1, 2, and 3, right?
The list. You mean?
Listing.
And here we're listing, right? Giving just the names. Why is that summarizing? Give only names.
Because we don't write the
dosage how many times.
Yeah, not dosage, route, schedule, etc. Okay. Okay, so this is summarizing. What about condition? Let's go a bit faster. What did I say yesterday for condition?
Aforementioned.
Main idea.
Everyone, what does it mean, aforementioned?
Previously
Once
mentioned.
we
already
Previous
talked
mentioned.
We already noticed.
So
it.
Mr. Jones underwent the aforementioned procedure. Right? I
Previously
don't need to
mentioned.
say left leg, tibula, blah, 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 procedure. I can just say aforementioned because where did I mention it before? I said it in the introduction, maybe.
Introduction.
Or maybe in the timeline, and now I'm in the timeline 2. Okay, what about visits? Very, very easy. Visit
Multiple.
average.
Like
Multiple visits, several
Multiple.
visits, frequent visits,
Number.
The occasions.
number of visits,
Tests.
Unremarkable, normal.
Normal. Unremarkable.
within
Range.
range
Right,
within
with
above.
stable. You can
Stable.
say he's hemodynamically stable. Remember we said that yesterday. Okay, what about equipment? What can we say for equipment? Summarizing.
Appropriate.
appropriate equipment,
Appropriate equipment was provided. Okay, conditions. How do we summarize conditions? Remember,
chronic,
Comorbidity.
Comorbidities, chronic. Stable, unstable.
Chronic
You can just say a
Comorbidities.
number of serious conditions, right? Chronic conditions, comorbidities. Okay, now guys, let's do a quick test. Okay, very, very quick test. You can all see this one here. This is real case notes now, real. Now, we can summarize these, right? But we need to think carefully about this because I think it might be a bit more difficult than you first think. Can I ask one of you to try and summarize this? Maybe Fazila or Wasma, could you put your microphone on? Mr. Green.
Yeah. Hello, sir.
Nice. Mr. Green's, put your microphone on. What can I say?
Mr. Green's vital signs was normal.
Were normal. Oops. Vital signs
Yes,
were normal.
Except the blood
Yeah.
pressure was high.
Except his
Pressure.
Blood pressure was
which is
a little bit high.
and then what else can I say about the doctor? And guys, and
It was not employed by doctor.
you can say and the doctor
was informed.
was informed. There you go. Okay. So the summarization is happening here in this example, but here we are not summarizing, are we? Here we're giving the details. And very good. You just said we can just use this. What does this word mean, guys? Except.
Only.
Only.
Without this.
Right, only the
Excluding.
so when you're summarizing with your tests, feel free to do this. His tests were normal except for. Except. Question? Someone have-
Apart from what? Apart from also we can.
We can also say apart from. What else can we say, guys? Apart from, with the exception of, we can say. Okay.
beside,
Say again?
beside,
We can't say beside. Yeah, it doesn't sound good there.
okay.
Okay, so you all get the idea. You all get the idea. Now, I'm going to do another test because I want to, you see, listing is also summarizing. So I want to just do a bit more main idea summarizing. Okay, so look at this. Real case notes. Clara, could you put your microphone on again, please? Or could we have Assad, if that's okay? Or Rufat as well, you three. One more time. How do I summarize again? What did you say, Clara, about summarizing? How do we do it? Main idea. How do I get the main idea?
Yes, to group the symptoms in.
To group together things under one idea, right? So here we have eye issues. Here we have respiratory issues.
Yes.
Okay. Now,
I think it's.
can you see anything here that is repeated that we can group under?
Yes, metrorrhagia and dysmenorrhea.
Menorrhagia, dysmenorrhea.
So these can be grouped together.
Yes.
What else can we group together, guys?
Menstrual bleeding.
Medication.
Medication, yeah.
Yeah, well, Cerazette and the Celeste, they are both contraception, both, yeah?
Mhm.
Any actions? What actions are there that we can group together?
Insert.
Actions, activities. Come on, guys, you can see this. Where's the action?
Yes.
Ceased once and twice on certain.
Ceased, right?
Yeah.
So let's imagine I want to summarize this now, right? I'm trying to get the main idea of this. I don't want all this information. I could say, Mrs. Green, right? No dates. Don't worry about dates yet. Mrs. Green. What does ceased mean?
Stopped.
Stopped.
Stopped, right? So Mrs. Green stopped. How do I summarize these two?
Stopped her contraception
contraceptive.
pills.
Contraception, right? So Mr. Green stopped her contraception how many times?
2 times.
So we can say twice or 2 times.
Twice.
Right?
Yeah.
Why did she do that?
To conceive.
Conceive, right? To conceive. We don't need to say child, actually. Okay. What about the time? Let's summarize the time as well, guys. Can anyone think of how can I summarize that time?
On different
Mrs.
occasions.
Green
Or
had several
twice.
Present perfect. Has
Well,
been
think about the
something.
times from or between. When did it happen? Anyone? You can all shout out. Mr. Green.
2011 and 2012.
Between 2011 and 2012. We're summarizing, right?
13. Yeah.
Mhm.
No,
There's different ways to do this, but do you see do you get the idea? Right? Now, let's imagine I'm writing to a specialist who actually needs the names of these. Is this good summarizing or bad summarizing?
Good.
If the specialist needs these names, Celeste and then it's bad. If the specialist needs the time specific, right? If the time is very important, then don't summarize. Does that make sense, guys? Well, actually, the case notes that I took this from, in the case notes, you can summarize this because we're not writing to someone like that. Okay. Is that clear for you guys? Because I think this is a very good example, very, very good example of summarizing main idea. Is it clear for everyone?
Yes.
Mhm.
Yeah.
Yes.
Okay. Now, my computer's gone a bit strange. One minute. Cannot move anything. One moment. Let me just take a quick photo of this. Okay, so let's move on now. All right, we've talked about summarizing. Yesterday I didn't show you any examples. Now I've showed you more real examples of summarizing. I want to show you one more example of main idea summarizing, and then we will talk about listing. Okay, guys? But this time, I'm sorry, there's a lot of case notes. Can you all see this here?
Yes.
Yes.
Right. Now, what's the name of the patient here, guys?
Mr.
Barry
Barry
Jones.
Mr. Barry Jones.
Barry Jones. And what is his problem? What is his injury?
Back injury.
Appendix
Yeah.
removed.
Injury.
Now, remember, when we're looking for main ideas, we're looking for things that are the same that we can group, as Clara says, group things together. I think here, you should be able to see something that is quite similar. Can anyone see something that is like, yeah, we can group this together? Let me know when you see it. Something that's repeating.
Year.
The year, it's all in 2015.
Black.
What about the visits, guys?
Is you?
In this letter, do I need to give all of this?
No.
No.
Don't. Why?
Because it's repeating.
It's very repetitive, right? So think about how could we summarize that in terms of dates? What could we say, guys? Between
2000.
April to
between
April to June.
between April and
March and April.
March.
March.
Okay. We could say Mr. Jones. What?
Was
Mr. Jones
presented with back injury.
attended my clinic how many times?
3 times.
4 times.
4 times.
You could just
Could we
say
say
number of
Sir,
times.
we can use
Number of
sir, we
times.
can use perfect continuous also, I think. So for describing multiple
You
visits,
could
has
also
been
do that.
visiting.
Yeah, we can. Yeah. What about, remember we said that comparison is also a type of summarizing. Comparison. Did he get better or worse during this time?
Recovering.
Good, good.
Recovering well.
Yeah.
So we could say his condition
Got better. Improved.
right? So here we're using comparison to summarize. Does that make sense? We're summarizing in two different ways. This is a classic example of places where we can summarize. All right. Any questions? Probably you have lots of questions about this one. Does anyone want to ask me any questions? Okay. All right. So
sorry, could we?
Yes, go on, Rafat.
Could we say over the last 4 or 3 months?
Yeah, this is what, guys, this is a great question. Everyone ask me questions like this. Yeah, you could say over the last 3 months. Yeah, and in DT, that's where you can use your present perfect continuous. Over the last 3 months, Mr. Jones has
been visiting
our clinic due to
regarding
ongoing
back problems.
Okay. His condition has improved, right? So that's the idea here. Now, guys, so main idea is very, very important, and we've done loads and loads of main idea. I honestly think, guys, that main idea is the most important form of summarizing, okay? Main idea. What are the other types of summarizing, guys? Comparison, right? His symptoms have improved, or his condition has improved, right? And
Listing.
Okay. Now this one, we're going to spend probably 40 minutes on this now, listing. Main idea, it's easy, you can do it once you realize how easy it is. Comparison, you can do it. It's you just need to think. Does that make sense? This is like about seeing where and having the vocabulary. Okay, that's what you guys need to be able to do. See where to use it. Okay, but listing, what's the main problem with listing, guys? It's actually a big problem. What is the problem here? Some of you know what listing is, maybe some of you don't know what listing is. The problem is grammar, okay? Grammar of listing. So today I'm going to teach you the grammar of listing. Is that clear for everyone?
Yeah.
Also, listing is very, very powerful. In some ways, it's actually better than main idea. In some ways. Why is listing sometimes better than main idea? Anyone?
Help in concising the, making concise.
Well, main idea is the most concise. Let me give you an example.
Some information about.
We can actually give more information.
More information.
Yeah, we can actually have detail. Right, have more detail. I don't have space. Okay.
And it might be summarized information as well.
So imagine you could summarize and also have the details. That's what you want, isn't it? That's what you can do with listing. So let's go and talk about listing. What is listing? Almaz, could you say hello, or Abdul Qadir as well?
Hello.
What is listing? Give me an example, or tell me what it is.
For example,
I think it's so bad. Sorry.
symptoms.
Symptoms. Look, we often list symptoms. Give me an example with symptoms. Mr. Green.
Mr. Green has been experiencing.
Or experienced. Yeah, doesn't matter. Yeah, experienced.
A headache, fever.
Headaches.
Sore throat.
So a headache.
A fever.
Fever.
And sore throat.
Say again.
Sore throat.
Sore throat. Is that a list?
And
yes.
sore throat.
We need and. So this is the first. This is the first rule, guys. The first rule of listing is. What is this rule here?
Noun.
What is the rule, Dr. Saki? Maybe you can tell me. What is the rule about and? Can anyone summarize it?
Yeah, after 2 or 3 comma, we should use the conjunction like.
It's not after 2 or 3. Almost. It's after. It's before actually. Before the
end of the last.
Yeah, the last. Let's call these items, right?
Yeah, items.
Yeah,
yes.
we're just going to call these item. right? Sorry, it should be and here, sorry. Before the last item, we need and, always. Is that clear for you guys?
Yes.
Do I need this comma here? Aditi, Almaz, do I
No.
need that?
It's not necessary, sir.
This is an optional comma, actually. What's the name of it, guys? Does anyone know the name of this
Oxford
comma?
comma. Oxford comma.
Did you see recently in politics the one of the British politicians was talking about the Oxford comma? Did anyone see that? This is called the Oxford comma. Okay. She actually is the health secretary. The health secretary. The health secretary of the head of the NMC and the GMC likes Oxford commas. She loves them. Also, I like them as well. Why is this comma good? Actually, we need this comma. Why? It's optional, guys. This is optional. So some people don't use it, but I think you should use it. Can anyone think of a reason why we should use it? What if I take this away? Is there a problem here?
No.
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 But
like
if
that,
we
okay.
have different subject.
But
What about this, guys? I ate fish, bread, and I don't know, tomatoes. Okay. Is that okay? Is that list okay?
Yes.
yes.
Yeah. Okay. Okay. What about if I say this? Fish and chips.
No.
Is that okay?
Yes. Yes, it's okay.
It's actually
Yeah,
okay. Okay. Because these two are
Yes.
Always
Together.
comes together.
one
Compound.
item, right? It's a compound noun, exactly.
Yeah.
Okay, but what happens if I write a sentence like this then? So here it's not so bad, but what if I say I ate bread, fish and chips, and tomatoes. What's wrong now?
Before
It shows
we
the
need
It's possible to get confused now, isn't it? Is it
Yeah.
chips and tomatoes, or is it fish and chips? Which one?
Yes.
fish and chips. We have to put.
So the Oxford comma is a good reason. There's a good reason to use the Oxford comma. Okay, for examples like this. Does that make sense, guys?
But
Yes.
can I ask a question?
Please.
Can we use and twice here? Does that look?
You're allowed to
Because-
use and. Yeah, you are. I know it's strange, but we do.
It's strange to do that.
Yeah. But a doctor, Rufat, a doctor once said to me, yes, this is good because sometimes medications are together. Is that true? Sometimes there are two medications and you want them to be taken together. Maybe you can do this. He was prescribed blank, blank, and blank, and blank. Can anyone give me an example of two medications that you might want to think like fish and chips?
Yes. The patient was prescribed metronidazole, ampicillin, and gentamicin.
So maybe those two there's the connection between the two.
Yes.
Okay. But anyway, this is a small point. Let's just get back to this, guys. What is a list? Definition? Very simple now. What is a list? Everyone, anyone, Yulia, Abdullah. A list is how many items should there be?
It's a type of summarizing.
It is a type of summarizing. Yeah, it's a type of summarizing. And can I have two items in a list?
No, more than 3.
It has to be, a list must have 3 or more items.
Item.
So can I say he ate fish and bread? Is that a list?
No,
No. But is it okay? Is it all right?
it's okay.
Yes.
But it's
Yeah.
not.
But it's not a list. It's not a list, okay? So a list must have 3 or more items, okay? Any questions so far, guys? Because we're now going to go into more detail. But is this clear? A list is a type of summarizing. It's got to have 3 items. You have an example here. You must have and at the end, and then you must have the comma here. This is called the Oxford comma. All right. Okay. So it seems actually probably easy, doesn't it? This seems easy. You guys are upper intermediate or advanced speakers of English. Maybe you're thinking, this is easy, okay? But it's not easy. Why? Why is it not easy? Because, okay, why do doctors make mistakes? Answer, they don't know the grammar. They don't know that there are, for today, I will say it like this, there are 3 types of listing. Does that make sense, guys? There are 3 different types. If you don't understand the different types, then you make mistakes because you're trying to use them, you're mixing them. Does that make sense?
Yes.
Does anyone know what the 3 types are? What's the answer?
Noun,
Noun,
verb, and
verb,
adjective.
verb. You can also do, okay, let's say there's 4 types then, but you could use the be verb and adjectives, yeah. But there's now, for today, we'll just say noun listing, verb listing, and
Sentence.
yeah, well, I like to call
Adjectives.
sentence or clause listing, right? We'll just call it clause or sentence listing. So let me give you an example. Can everyone see this here? We're going to make a diagram. You guys are going to practice this.
Yes.
Is it clear? Is it big or small? Do you need it bigger?
Normal.
Okay. So
Okay.
she experienced dizziness, tired, nausea, and anxiety. Can I ask Fazila, can you say hello? Or Wasma, can you say hello? Can you look at this sentence here, please?
Yes.
Hello.
Wasma. Okay, so here, what type of listing is this? Noun listing, verb listing? What do you think?
Mixed.
Noun, I think.
This is noun listing, okay? But can anyone see an error?
Yes.
Yeah.
Okay, Almaz was first.
Tiredness.
What's the problem?
Tiredness.
Why is tired not correct? Why is that? Why is tired wrong?
Tired is verb.
Because
Adjective.
tired is adjective,
Adjective,
are
that's
noun.
An adjective.
We should change to a noun.
So this is the first error that you always see. Word formation error. I'm listing nouns. I cannot put adjectives in my list. Okay, so I have to say, what's the noun form, guys?
Tiredness.
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 So rule number 1, every item must be a
Noun.
No.
noun.
Noun.
Okay. So can I say this, guys? She experienced dizziness, tiredness, nausea, and dizziness, tiredness. I'm trying to think of vomit.
Vomit.
No,
Vomiting.
vomiting.
No, vomiting.
Because vomit
Should be vomiting, right? Is that a noun?
Yes, it is a noun.
Yeah, it is a noun.
Yes.
Noun.
Also, vomit can be a noun, but it's also a verb as well.
Verb.
Yeah. So INGs, when I say noun, I'm going to put including INGs. Okay. Now, can anyone guess there's another big problem that sometimes people make? A big mistake. Let me show you. What if I say this? She experienced dizziness, tiredness, doctor, nausea, and anxiety. What's wrong with that? It's easy to see, but why is it wrong?
Not proper noun.
Not symptom.
Not matching.
It's not symptom.
Noun.
It's a noun. I'm listing nouns. Why is it wrong? Why
list
is it-
of
It is not right.
Same
It's
group.
not
Because
appropriate.
it's
Not
Not relevant
It's not relevant as well, but it does not match
with the word.
with this.
It's not part of the symptoms.
because it's symptoms.
Right? So you can say the rule is every item in the list
Match.
must match the verb.
So, verb.
Let me give you a more difficult example. What if I said broken leg? Is that right?
It's not a
No.
symptom.
No.
It's
No,
not
we don't
experience.
say, oh, Aditi experienced a broken leg. That sounds really
She
strange.
had.
It's very, very painful, broken leg. So we don't use that verb. We say had. Yeah. Or we just say she broke her leg. right? Or she has a broken leg. She had a broken leg. You wouldn't say experienced here.
She experienced pain
right?
instead of broken.
Yeah, well, if you're doing something like this, guys, take it out of your list. It cannot be in the list. Make a new sentence. Does that make sense, guys?
Yes.
All right. So these are the key rules. Number one, every item must be a noun. And the verb you choose must match every item. Let's do a quick test for you guys. Backache, mouth sore, rash. Now, this is going to be tricky, okay? I'm going to give you guys 30 seconds, and then I will choose one person here. You must put your microphone on and say one sentence, all right? So 30 seconds starts now. How can you make a sentence here? Can you make a list? Just think about it, please. 30 seconds. Okay, I'm going to choose Assad if he's here, or Anka, whoever wants to come first. Assad or Anka. Can you say hello, please? Come on, Assad. No? Gabriella then. Zaki. Sorry, Zaki, I didn't realize. I spoke to you at the start, but I didn't write down your name. Zaki, could you say hello?
Hello.
All right. Mr. Green, let's make a list here. So, Mr. Green.
Mr. Green had backache, mouth sore, and rash on his shoulder.
What do I need next?
Comma.
Comma.
Mouth sore.
Mouth sore. Do I need anything, a small word here, Zaki?
Ah.
Yeah, mouth sore.
Yeah. Mouth sore, comma.
And rash
Rash
on his shoulder.
Give me a chance. Just Zaki, please. And a rash
on his shoulder.
On his shoulder. Is that right, everyone? Yeah, right?
Yes.
Can I say experienced here?
Yes.
Yes.
No.
Yes.
Can you experience
Mouth sore doesn't go to this list.
Yeah, it doesn't sound, maybe experienced mouth sore doesn't sound exact. It's not that bad, but yeah, had is probably better here because it sounds better with mouth sore. Yeah, great. So you get the idea, guys. Is this clear so far to everyone? Any questions?
Yeah. Well, sorry, why did you put the comma after mouth sore and then and?
Because this is the Oxford comma that we were discussing before.
Okay.
So remember, item 1, guys, will be here. Item 2 is here. It's a compound noun, right? And item 3 is all of this together. So there's 3 items in our list. Okay.
So you mean that because mouth sore or like 2, that's why you put comma?
Yeah, this is all together. Right? This is, you can think of it, Wasma, this is like an adjective. It's like an adjective. This is your noun.
Yeah.
You know, like a red thing on your mouth. Okay. Okay, great question. Now it's going to get more difficult. Now it becomes really, for me anyway, really interesting. Okay, because what about this one? This one's very, very different. Can I ask Almaz if you could say hello? Or Ismail, I know that you are sort of new, but if you could put your microphone on. Or Anka, she experienced dizziness. Oops, why does it say the feel down? Let's say fall down and prescribed medication. Can you say hello there, Wasma? Listen to here. No Wasma, no Anka. Rufat? What type of listing are we dealing with here?
What type? This dizziness is prescribed. This verb?
It's verb listing, but there are some errors here. There are some errors.
Because dizziness fell down, experienced and prescribed.
But we need to
So
remove busy.
let's think about what the difference is here. In this example, everything is a noun, right? So dizziness, is that a noun? Yeah. Is this a noun?
Yes.
Yeah, nausea is a noun, right? It's a noun for the feeling. Anxiety, is that a noun?
Yes.
Yeah, okay. But here we have experienced dizziness, and then we have fell down.
Fell down.
What's this? It's that one guy.
Verb.
That's a verb, right? What is it?
Yes, verb.
But
And what's-
why not now? Because this we have one verb and one noun. Business and fill down. These are two. And also,
Well, this is a preposition.
No.
yeah, but one verb. Yes, just fill.
But you can have a noun as well.
I think
No,
it should be dizzy.
Yeah.
No, it's okay.
I think we should write dizzy. Dizziness is a noun, sir. We can write
Yes.
dizzy.
That's what I'm saying.
Okay,
It's
no. No. Just because I'm calling it verb listing, you can have the nouns as well.
Mhm.
I just don't want to call it verb noun. It sounds silly, right?
Because
Look, give me
experience.
a simple example. Alan walked, spoke, and ate. Okay, are these all verbs, guys?
Yes.
Yeah.
Okay.
Yes.
Okay. Alan
it is.
walked home, spoke to his mum, ate food.
Yeah.
Is that okay?
Yes.
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 Well, I'm just putting the nouns in, okay? But it doesn't matter. You don't need the nouns, Aditi. They are optional. Does that make sense, guys? So it's verb listing. The important thing is the verb must change,
Yes.
okay? And this is what I'm trying to show you guys. The verb changes each time. Does everyone see that these are all different verbs?
Yeah.
Yes.
Now, does anyone see a problem here with this? It should be what?
Medication prescribed.
Was prescribed.
Medication was
Was.
prescribed.
Medication
Was
was
Well,
prescribed.
you can put medication, but we need the verb was prescribed, okay? Is that okay? Can I use the passive voice?
Yes.
Yes.
Why not? Why not? It's just the same item. So look, verb, verb, verb. Does that make sense, guys?
Yes.
Yes.
So what's the rule then? What's the rule? There's only one rule. Each item, Safi,
Must
each item
Matching.
must be,
Verb.
well, let's say each item must, be a verb, I guess. Must be a verb.
One match.
No, I'll just put it like this. And you can have a noun if you want. Right? If you want. It's just like with noun listing. Look, I can put an adjective here if I want. Right? She experienced bad dizziness. This is an adjective, but it's just describing the noun here. Okay? So each item must be a verb. And you can have a noun if you want. Does that make sense?
Yeah.
Okay, so let's try and do some exercises. Aditi, can you just, I know you've done this before, and we can have Gabby as well. Will you say hello?
Hi, Alan. I want
Gabby.
to tell about we need to have the same subject. It is very important when we do a listing.
Well, I'm going to talk about that here because no, you can change the subject if you want. Right? Let me give you an example. She experienced dizziness, right? Her father fell down and her mother was prescribed medication. Is the grammar okay?
Yes.
Yes.
So do you see now why this is such a powerful technique? Do you see how useful this is? Let me give you an example, right? Let's take any three sentences. Alan bought a TV. Let's say Assad ate a sandwich. Give me anything you want, guys. Aditi studied grammar. What else? Anything you want. Come on, one sentence, anything. Oh, you're just going to leave me waiting. Come on, give me one sentence. One of you, please.
I buy a car. I buy a car.
Thank you. So let's say James bought a car. Now, if I want to make a list, what do I do? Comma.
Comma, and.
Is that okay?
Yes.
Yes.
Does it seem like a very complicated sentence?
No.
For people who do not know about listing, they will probably be very impressed by your big sentence, right? I think the examiner will think, wow, this is amazing grammar, but it's very easy. Okay. Now, Aditi or Gabby, Mr. Green was
admitted.
just Gabby was admitted to
the hospital
Cool.
treated by a doctor and returned home on 19th of September.
Is that right, guys? Is there any mistakes there? There is a
Was
mistake.
treated. Was treated.
Oh,
Yes.
now do I need was
No.
here? That's a very good
We
question.
once,
Do I need it?
we once
It was same.
We
No.
already
was, yes.
This
was.
is what
Not
this is why
necessary.
I love listing, right? If the item before also has the same auxiliary, you don't need it.
Yes.
If it's an article as well, you don't need it, right? So here, if I want, I can remove it. Why?
Because we already have one before.
If you want, okay? So we don't need was. So is this clear for you guys? This one easy. Let's try someone else then. Diagnosed cancer. Let me ask Hilal or Safi. Could you say hello? Or Zaki? One of you three. Diagnosed cancer, treated chemo, recovery good. Come on, you can do this. It's easy. Saki, could you say hello?
Hi.
Oh, yeah. Or Ismail as well.
Yeah.
Ismail, do you want to try this? Mr. Green.
Mr. Green was diagnosed with cancer,
Okay, was diagnosed with cancer.
was treated by chemotherapy.
Do I need was?
No,
Not
I'll say
necessary.
treated. It's optional, but you will sound more natural if you remove it. So Ismail, treated with
Chemotherapy, chemo.
Yeah, good. We don't say, guys, should we say chemo? Is that good? No, it's very informal, right? So chemotherapy and
Recovered.
And
He made a good recovery.
Recovering.
made. Yeah, made. Good.
Made a good recovery.
And has made will be good.
If it's
So
true
has
now,
made a
true now, yeah, you use present perfect. Also, what about this? Recovered. Can I say recovered good?
Well,
Well.
well.
Okay. All right, last one. This is actually quite difficult, this one. Can you go to the chat box, everyone? I want you to write me one sentence in the chat. Visited clinic, reported SOB, advised lifestyle change. Okay, off you go. Write me one sentence in the chat box. I want a list, remember, with this one. Don't confuse it with another type of sentence, okay? This is item 1. So, Rufat. Yeah, nice, Rufat. And you've put in the subject, because you're changing the subject at the end. Yes, that's the difficult bit. Excellent. Gabby. Again, excellent. We're putting in the subject here, aren't we? Excellent. Good. Kaksar. So Kaksar, what you're doing is very good, Kaksar. What you're actually doing here is clause listing. And I'll show you that one soon. Let me see if I can copy this. So Kaksar, very good. Yulia, she's putting the date in, which is nice. Excellent. Ria. Now Ria, this is the problem, Ria. You're not giving me a verb, Ria. Right? But this is so Ria, I'm going to take a copy of this and I'll show. I'm sorry, I'm going to have to show everyone now. Keep going, guys. Keep trying. Ria, try again, please. Mohammed. Yep, excellent. Almaz. Excellent. Fantastic. Keep going, guys. No more? Okay, well, we've had loads anyway. All right, so very, very good in general. Can anyone tell me what's the problem with this one? Ria, if you could put your microphone on, maybe you can correct yourself, Ria. Could you say hello? Otherwise, we will do it for you.
Hello.
Hello. So, Ria, Mr. Green has visited clinic. So here we can just say, whose clinic is it, Ria?
Our.
Wait a second. This isn't your one, is it?
No, this is not mine.
Guys, let me just show you. This is the kind of error we always see all the time. Let's see if I can try this again. Why isn't this working? Copy. There we go. What's wrong here, guys? Anyone? Ria, you can tell us, or anyone.
Unadvised. Was advised should be because
Reporting.
It's breaking the number one rule. Must be a verb. Is ing a verb, guys?
Report.
No.
No. If you want to make it a verb, you need to put one more word here. What can we put?
Been.
Alan, the preposition is
Past
also
continuous.
to. Mr. Green with it.
Yeah, the two. You're right. You're right.
Yeah.
Is that Abdullah?
Yes.
I didn't see you there, Abdullah. Sorry. Yeah, but guys, we can have was reporting here, right?
Yes.
Now it's a verb. If I just say ing, it's a noun. It's completely wrong. Okay. But why, Ria? Why did you use past continuous? Why not stay with past simple? Why did you change the tense? This is
Because
verb
it just
listing.
came to my mind.
Okay. Just stay when you're verb listing, right? Visited, reported, advised.
Yeah.
You see what I mean? Okay. Now, what should I put here?
He was
advised.
He was
advised. Or I could even say the doctor
advised him.
Advised
him. When I say the doctor advised him, what am I doing? I'm changing
To active form.
Well, I'm changing it to the active, but I'm also, is the subject now the same?
No.
No, change. Can we do this? Is it okay?
Yes.
It's completely okay. You can do it actually on the third item of any list. I'm going to say that again. The last item of any list can be a full sentence. What do I mean by full sentence? What does that mean?
Noun, subject, object.
Right. So even this, guys, I can say Mr. Green had backache, a mouth sore, and
I rush.
No, let's change the subject.
Okay.
But now is a sentence
or
not?
It's a new sentence, yeah, but it's just the listing is like this. I don't know why, but listing, I can say his mother. What's the verb, guys?
Told, said that.
Reported.
Had. Oh yeah, okay. Told him.
Told.
He had.
Rush.
Right. So it's so cool the fact that you can put in the subject. So this is the final type of listing. The final type is. What did I call it?
Sentence.
Call it sentence listing or clause listing.
Clause, yeah.
Call it clause. So let's have a look at this example here. Kaksar, could you say hello?
Hello.
So you already did one. You did this already. This is what he wrote, guys. Mr. Green has visited. What do we need here, Kaksar?
Our
clinic. He reported that he had.
I had, yeah.
He had SOB and he was advised to change his lifestyle. What do you notice about this sentence? It's not verb listing, is it? It's not verb. It is. It's all subject.
Close.
So, can I ask one question?
Yeah, go on.
So, sir, I think if the subject is same, it is not looking good to repeat the same subject.
That was going to be my next
think
question.
when the subject change,
exactly.
When the subject changes, it is more good to put the other subject.
You know, in language, we often, if we don't need it in language, we often don't say it. You know what I mean? So, Kaksar, do I need that here?
No, that's extra.
No.
It's not necessary, is it? But the grammar is not incorrect. It doesn't actually sound that bad. Just a little bit repetitive. But can I change the person? Aditi, Ria, Wasma. What if I wanted to change it to his mother. Is that okay? It's okay, right?
Yes, sir.
Yeah.
Yes.
Give me
Helen.
another example. So what about this? What can I change this? He
His
could be-
child.
It should
And
stay.
last one, we can write doctor advised
Give me an example.
if you want
Him,
to.
His
him
mother
had.
reported that
Him had.
That's her son
He had
had is okay.
her
her
son.
son.
Yeah, there we go. Her son had nice. Really, really, that's excellent. Yeah. So her son, and then we go back to and he was advised. So now
The
we can say the doctor.
Doctor advised.
Advice.
We have it in the active, right? So this is so powerful in OET because you can summarize. You can summarize so many things in one sentence. Just subject, verb, comma, subject, verb, comma, subject, verb. Does that make sense, everyone?
Yeah.
Yeah.
Let's try it here. Who
Helen?
wants to try this? Oh yes, go on, Dr. Saki.
Yeah, the sentence I just wrote, is it correct or no? I was a little bit confused.
Is it in the chat
Mr.
box?
Yeah, Mr. Green recently visited my clinic and reported shortness of breath. I advise him on lifestyle change.
No, because there's only 2 items here, I think. So you're breaking the rules. Let's have this one
Oh,
here.
that's-
Is that the one? No.
No.
Let's try again. Copy. What's wrong with this, guys? What's wrong with this? And anyone? Mr. Green recently visited my clinic, reported shortness of breath, and I advised him on lifestyle. Well, wait a second. You've got no commas. Where are your commas?
Yes.
Here.
Yeah.
What do I need, Dr. Saki? What do I need here now?
And
And
Right? So item 1, visited. Item 2, reported. Item 3, I advised. So this is not clause listing. It is verb listing.
Verb.
Yeah. So that is okay, but you need to make those changes. Guys, in fact, Dr. Saki, you try and do this with me here. Mr. Green exercises regular, dietitian monitor diet, daughter at care and support. But let's make a sentence. What can we say? Mr. Green.
This sentence, okay. Mr. Green experienced regular testing.
We'll start with this one.
Okay.
Mr. Green exercises. Guys, it's really easy. Exercise regularly. Okay.
Regularly.
Just Saki, please. Just him, because I asked him. Now, this is a new subject. What shall I say? Dr. Saki, or if we
in dietitian.
Emily as well. His
dietitian.
Now, past tense.
Monitored
or
has.
Do I want present tense or past tense, guys? Can I change the tense?
Present.
You can change the
We
tense.
could say monitors his diet.
Monitored.
If you want, maybe we can keep the same tense, but actually it's not necessary. You can actually change the tense if you want. It's actually okay. So exercises regularly. His dietitian monitors his diet. What's
His
next?
diet.
Anyone? Anyone? And
his daughter provided care.
Was advised.
provides care and
Care and support.
Support.
okay. We'll do one. I know I'm going a bit fast, but it's just because I have I'm not finishing really. This last one, you guys can all try in the chat box, okay? Mr. Jones visits specialist, transport, daughter. Okay, it's easy if you have time. Go into the chat box, type this sentence, and then we will finish this class. Okay. This is your last input. Then I'll show you some examples with real case notes. There we go, already from Mohammed. That was from the previous one, Mohammed.
Yes.
Yeah, you just need, Mohammed, you just need cared for and supported by his daughter.
Okay.
That makes sense.
Okay, thank you.
Put it here. Have a go, guys. Mrs. Jones visits specialist, transport, husband, where's the subject? Daughter, assist, return. Just have a go at typing it in there. wonder who's going to be first here. Mr. Green. Sorry, Mr. Jones. There we go. Excellent. They're coming through now. So I'm going to read names. Kaksar.
Yes, sir.
It's correct. I'm saying the names. I read your one. That one is correct. Julia. Correct. Almaz. Almaz, your second, you need this one. You have no subject, right? Mr. Jones visited a specialist, comma, her husband. Almaz, try again. Ria. Excellent. Gabby. Excellent. Mohammed. Again, Mohammed, the third item, you need to start with the subject, Mohammed, right? You're not starting with the subject here. Does that make sense, Mohammed? Try again. We saw Gabby, good. I think I've done Ria. Fazila. Excellent. Abdul Qadir. You forgot and. Remember at the start I was saying the and? People always forget and. Abdul Qadir, there's no and. It's completely wrong now. So it reads very badly. You've got to have that and. Sama. Sama, you are doing all verb listing, but it is correct, Sama. Okay. Wasma. Excellent. Anka. Excellent. Okay, so most of you have got this then. Brilliant. Can anyone tell me what's the error here? Mr. Jones, visitor specialist, husband provided transport and assisted by daughter on her return. What's wrong?
Assisted, because assisted, she was assisted.
Yeah, where's the subject? Right? That's the verb, isn't it? So she was assisted by or her daughter, or we can say her daughter
assisted
her, right? So subject, verb, subject, verb, subject, verb. That's what you were talking about with clause listing. Okay, let's stand back because I am very busy, but you can go, guys, if you want, but I'm going to show you just some more examples with real case notes now. I know that we are now on 20 minutes past 1, but if you want to stay, I'm happy to stay because we're going to look at some real examples. But does anyone have any questions about all of this before we continue?
Can we get this documents?
Yeah, take a photo now as well if you want, but this document will be available on the website this evening.
Okay.
I try and put it on as soon as possible, but sometimes there is a delay with the upload, but it will be on today, maybe 8 o'clock, maybe 9. Okay.
Can you show the picture of earlier works also?
Yeah, which one? Sorry.
Earlier one where summarizing box.
This one. Take a photo, yeah?
Yes.
Because I made it more clean here. This is actually, Aditi, it's on the previous, if you go to yesterday's class, I tidied this up more, actually, it's better. Go and look at the yesterday's class. I just did that this morning, okay? Now, guys, okay, so blah, blah, blah. Okay, maybe you understand me, maybe you don't, but we now are going to go into an exam situation, right? So with no help, can everyone see this here? 14th of October, dizziness, chest pains, mother equals anxiety, right? Everyone, what kind of listing should I choose?
Attended to dizziness, chest pain.
What type?
Noun.
So what noun, I think, but what about the mother here?
Subject. Close listing.
Can I change the subject in the last item?
Yes.
Yeah. Yes.
Yeah.
His mother.
Yeah.
So I'm going to do,
Had.
so I'll use noun listing, but the last one, I will talk about the mother and I will change
Mother.
subject, right?
And his mother
So
reported.
Mother reported. He has.
we can all do this together. It's easy now. Ready? So on 14th, everyone.
October. Patient attended.
One second, my
With
typing is
dizziness.
so bad. 1 second. October. Mr. Green.
Mr. Green
Yeah.
attended.
Attended with
Attended.
dizziness, chest
With
pain.
With, you can say with.
dizziness.
With
Is that a
dizziness.
noun or is that an adjective?
Noun.
Noun.
It's okay, right? It's okay. So
Chest
dizziness.
pain.
Okay.
Chest
Chest pain.
Pains.
And
And his mother
and his mother
Reported.
Reported.
Oh yeah, reported.
He has.
he had
But, oh yeah. Had
Had anxiety.
anxiety.
anxiety. Excellent. Is this clear for you guys? Right.
Yeah.
Why is this summarizing? Because you can put everything into one sentence. Okay. Now, so this would be noun listing. This would be easy. Let's make it a bit more tricky, shall we? Let's make it a bit more hard. I've got another one for you, and I might give you a bit of time to think. What type of listing do you think we should do here?
Verb listing.
Clause listing.
Close.
Sentence. Close.
Is it all the same person?
Yes.
Yes.
No, we can use passive here, right? We can use that
Yes.
passive. So probably verb listing.
verb listing.
Yes. Well,
Okay. Where are my verbs?
stop.
Stops, reported, and restarted.
Reported and restarted.
Okay, so Rufat, could you put your microphone on, please?
Yes.
Mr. Green.
Mr. Green, I was advised.
Let's put the dates in on 15th September. Sorry, September. Mr. Green. Yeah.
Mr. Green stops his antidepressant.
You could say
Was advised
if you want. Yeah, advised to
stop.
Advised to. Well, we don't actually. Be very careful because maybe he did it himself. Maybe he didn't get advice. We don't know, right? So Mr. Green stopped his
Antidepressant.
Right. And then Rufat?
He reported. He reported.
And reported.
Do I need to say
And
he?
reported, yes. No, it will be a sentence
he had
in that case.
Same subject. It's the same subject.
Reported.
Mood swings.
Mood swings.
On 22nd September. On 22nd
And
September.
On 22nd.
22nd September.
Comma. And Rufat, what do I need now? Everyone, I need.
And fluoxetine was listed.
And
he was
I appreciate all of you guys,
Restart.
but let's just have Rufat finish this sentence and
fluoxetine restarted.
yeah, start with the drug. Okay. I don't want to. I'm lazy. So blank restarted. On
10th of October.
Now, is there a small error here, guys? What do I need here?
Yeah, we need a subject.
Was it's the passive. We
Yes.
use the passive. Okay. So this is verb listing, right? We have stopped, we have reported, and we have was restarted with the passive. Okay.
Alan,
Yes.
Questions?
can we say, Alan, can we say like that Mr. Green stopped his antidepressant? Because of this, he reported mood swings. Can we say?
Yeah, you can put these extra, you can put, language is very flexible because of this, or you could say as a result.
Mm-hmm. Okay, thank you.
Yeah, but you actually don't need to do it. Guys, normally when you tell a list, number 1, 2, 3, the reader will normally assume that it's happening in that order. Does that make sense?
Mm-hmm.
Like if I say, I got up, put my clothes on, drank coffee, and drove to work. Automatically we think, okay, 1, first, second, third, right? With a list, you can actually tell a whole story with a list. For example, an OET story, ready? Mr. Green was diagnosed with blank, comma, was treated with, comma, and is recovering well. It's a story, isn't it? You're telling like a very, very summarized timeline story. Does that make sense? It's very, very powerful, this technique. Let's have a look at this last one. What type of listing should I use here? This is real case notes now, real case notes. Patient drinking wine regularly, wife meals.
Close.
Sentence
Yeah, because
close.
we have a different subject here.
Yeah,
So
subject.
you could say, Mr. Green, everyone? Emily or Ria or anyone? Mr. Green
Is drinking
Drinks wine.
regularly.
His wife.
His wife
His
cooks his meals, comma,
and
patient.
He's not exercising.
he does not
does not do is probably best. Does not do. Not doing. No, he does not do
He's not do.
any exercise.
any exercise.
Exercises.
Okay, we're going to finish that. But so my last question is this. I can do this if I want, no problem. It's very nice. But do I need to do this? Because think about this. Do I need to do clause listing here?
Could do verb listing as well.
I could also change it because the wife, I could put to number 3, right, guys?
3, yes.
So Aditi, give us an example where I will change it. So
We
Green
can
drinks wine
say,
regularly.
doesn't do any exercise,
And
and his wife cooks his
meal.
And Kaksar, could you say hello?
Yes,
You can
sir.
remove he.
There's something here that I don't need now.
He can be removed. Because
Yeah,
we
right.
already talked about the subject. Yeah.
Exactly. This is verb listing, but we have the subject at the end, right? So when you're doing a list, you can move the things around to be more convenient for you, right? So I'm going to finish there. Does that make sense for everyone?
Yes.
Yes.
Any questions before I go?
Thank you.
Thank you very much.
You guys are amazing. Thank you so much. Now, I need to say just before we finish, I'm on holiday, so Paul will be taking all of the classes next week. And then I think we're going to change over. I think I'm going to take the nurses and Paul's going to be coming and doing the doctor's class more regularly. Obviously, you all know Paul. He is a very, very experienced OET teacher. We both start at the same time, but I'm just letting you guys know I'll be in the nurses. So I won't see you as much, which is a bit sad, but I think I'm going to keep the 3 p.m. class. So I will see you all in the 3 p.m. class. And I think I will also be doing speaking a little bit. So I will see you guys then. But I actually feel quite sad that I'm not doing the doctors. You guys are amazing. You guys are amazing. Okay. It's absolutely my pleasure to teach you doctors. And we have, honestly, I'm so proud of this class that we have. Doctors class.
But why do you change?
High level, such a high level. Yes, go on.
Why do you change?
So I'm going on holiday for a week and Paul is taking the class. And then when I come back, he wants me to do the nursing. But I will keep the 3 p.m. I will always do the 3 p.m. So guys, I will see you today at 3 p.m. All right? For reading. Thank you very much.
Okay.
It's my pleasure, guys.
Thank you so much.
Thank you. Thank you.
Bye, guys.
Thank you.